Thank you so much for joining us at Abu Dhabi Global Health Week.
You're welcome.
There's a real focus on longevity at Abu Dhabi Global Health Week, but it is a bit of a buzzword. What does it mean to you?
So I think when we think about longevity and what are we trying to accomplish in healthcare, historically, a lot of our focus has been on sick care, on waiting until you get sick and then responding with an intervention, and then extending life years, quantity of life, as opposed to quality of life. When we talk about longevity, I think we're largely talking about two dimensions that have been too absent in the past. One is a focus on prevention. So in other words, how do we ensure that we're thinking about our lifestyles, the things that we eat, ways that we can diagnose a trend towards sickness years and years and years in advance and make sure we're catching that early. So rather than being on a trend to sickness, we're actually maintaining wellness at an earlier stage of our lives. The other aspect, I think, is wellness more broadly. So the goal not being to avoid disease or avoid death, but actually ensure high quality of life. And that's both at the end of life, where we can be fit and happy in addition to being alive, but also throughout one's life so that we're not just focused on physical health, but also on mental health and well-being more broadly.
Walk me through how you see the role of the WHO Foundation at a time like this.
The WHO Foundation's purpose is to mobilize engagement from and resources from a broader set of stakeholders than government. So the World Health Organization depends on government, and government delivers healthcare in so many places in the world, but we can't deliver healthcare effectively and achieve the mission of health for all with government alone. So my job and the job of the WHO Foundation is to engage philanthropies, business, and the public in the mission of WHO. Abu Dhabi and the Emirates are playing a leadership role in a moment of transition in the world. The global health landscape has been dominated by a few particular countries who have acted as donors, though of course the real work is an implementation in low and middle income countries. But so much of that work, both the development funding and the diplomacy, has been occupied by a very limited number of countries. That is changing. The United States, the UK have both announced reductions in aid, and this is a moment in which Abu Dhabi, I think, is stepping up, both in terms of innovations from business, but also in terms of government and philanthropy to play a leading role in global health.
Walk me through how you see artificial intelligence playing a role.
AI is making the delivery of healthcare more effective and efficient, and particularly in low-income settings where you have far too few healthcare workers and where people are now empowered with their smart devices. They are seeking information, seeking healthcare from their own resources, which AI can power, but also the healthcare workers that may not be specialized in particular diseases or procedures, they can be empowered, equipped, they can deliver more care as a consequence of AI.
How does the WHO evolve in your mind, given all of the disruption as well as the innovation?
I think the WHO has to evolve, but it also has to continue to play the role that it's played for 75 years. For many low and middle income countries, the WHO acts as the equivalent of a US CDC, NIH, FDA. The WHO is a normative body that makes sure that it is evaluating evidence and ensuring that people around the world, through their governments, which play a critical regulatory and normative role, have access to the best evidence, the best technologies, medicines, technologies like vaccines and diagnostics. That role of WHO is its historic role, and it needs to retain that role. But how it delivers that has to change. And it has to now be able to arbitrate and guide countries on how to use technologies such as AI, which are evolving and iterating almost faster than we can keep up. I'll give you another example of how the WHO has to evolve. For so much of our human history, particularly in the last 100 years, medical care, healthcare has been delivered by a healthcare provider, by a doctor or a nurse, even a community health worker. Now, health is being delivered through the internet. The number one source of health information for an individual, whether you or me or someone who lives in Southern Africa, is TikTok, is Google, is YouTube. And so as a consequence of that, WHO has created partnerships with Google and Meta and TikTok to make sure that the health information people are receiving is accurate and actionable when they're receiving it as individuals, as a consumer, not only through a healthcare provider.
It's a brave new world. What are some of the things that you are watching as we go forward? What's on the horizon?
I'm watching to make sure that as we pursue innovation like AI, we do so with a commitment to equity. I think that it's very exciting for people with privilege, with resource, to see the opportunities of AI, to feel the impact of AI. I can open up my phone and I can feel that impact immediately. I can save a few dollars. I can save a trip to the doctor. But what I keep asking myself is, what about the billions of people who don't have access to the internet, who don't have access to clean water? How do we make sure that these innovations are addressing the equity gap in terms of healthcare and well-being? We've made a lot of progress in the last 25 years. Tens of millions of people are alive with medicines that were developed in the West but are now available at low cost all around the world. Vaccinations available to over 1 billion children over the last many years. New products developed that we wouldn't have thought possible years ago. And as I mentioned earlier, technologies like AI that help deliver services more efficiently with limited resources in low and middle income countries. So there's a lot of good news. We've closed or narrowed the equity gap. I think the question now, particularly as governments pull back on aid, and also as the acceleration of technologies proceeds, how do you make sure we don't lose that progress, that we don't lose ground?
It's great to have you here at Abu Dhabi Global Health Week.
Thank you very much.